Now we're good. I'm going to share again. And we're good to go. Here we go.
Okay, so we're going to use this form of presentation because otherwise, as Dubraska said, the slides were changing all by themselves, and that's not exactly what we want. Anyway, this presentation is actually of two parts. One is inducing lactation, and the next part is relactation. So where a mother may have stopped breastfeeding for some reason, usually because of bad advice from doctors, or that she felt she couldn't carry on because of all sorts of reasons like sore nipples and so forth. So let's start with the inducing lactation. So can you change the slide, please? Or can I do it? I don't think I can do it. We've talked about that. Okay, so we have an ebook that came out a couple of years ago. And if you go to Amazon where you live, then you can get the book. It's pretty inexpensive. We made it deliberately inexpensive. It's about $7 US for the book as an interactive ebook. The paperback is more expensive, but I don't remember. People don't seem to want the paperback, so okay, never mind. If you want it, you want it. Next slide, please. Okay, so with a lactation consultant a few years ago, we made up a protocol for inducing lactation, and I think that she went off on her own and gave all sorts of ways of inducing lactation, and it's really very complicated, and I actually don't agree with them anymore, even though it's got my name. So next slide, please. Okay, so why induce lactation? Well, there are many reasons, of course. A person might want to induce lactation because they are adopting a baby. Now, that's probably the most common thing that we have. There's a couple that for some reason are adopting a baby. Maybe the couple is infertile, or they haven't been able to get pregnant, or there are medical reasons for which that person may not want to become pregnant. And they have some will have a gestational carrier for the biological baby, or if they are in a relationship with a woman who is pregnant and wishes to breastfeed the baby as well. So often a same-sex couple. Another relationship, often transgender, where one or both of the partners wishes to breastfeed, or they wish to restart breastfeeding after a baby has been weaned, which we talk about later. Next slide, please. So, do you have to have been pregnant in order to breastfeed? And the answer is no. The only organs necessary for breastfeeding are a functioning pituitary gland and a functioning breast. And you only need one, really. If you can feed twins with two, you can feed one with one. Note that chromosomal XY have functional breast tissue. That is, men who are XY can make breast milk. And in fact, they can get breast cancer too. 1% of all breast cancers are in men. Anyway, you don't need a uterus, you don't need ovaries, you don't need a cervix, you don't need a thyroid gland. So women after menopause can breastfeed as well and induce lactation. Next slide, please. In the past, the concept of induced lactation is not that rare. Wet nurses who did not always have their children, they just put babies to the breast, and by the babies latching on and sucking, they started to produce milk. It's something I read about. I find it hard to understand how they could produce all the milk a baby might need, but certainly they produce milk even though they had never been pregnant. Women who breastfeed a baby in their family as unmarried aunts, the same information as with the wet nurses. Again, I don't know how they could get all of them, all the milk the baby need, but it occurred. And there are societies where breastfeeding is not just the mother who does it, but breastfeeding is shared with other women as well. Apparently this is not that uncommon. And XY men can also, in rare circumstances, breastfeed. So next slide, please. Now, this is not my photo, but this was published in a journal, and this man whose wife had died put the baby to the breast, and apparently, I mean, I can't speak for this. I mean, you know, there's all sorts of fake stories on the internet and in articles, but apparently this man was producing milk and the baby was thriving. Next slide, please. So, not pregnant, never been pregnant. How? Make the body of the person inducing lactation believe that they are pregnant. So how do we do that? Well, you know, it's complex. A real pregnancy, the hormonal milieu is very, very complex. And there's no way that we can copy that completely artificially. So what do we see when a woman is pregnant? We see higher levels of estrogen than during the non-pregnant state, higher levels of progesterone, higher levels of prolactin, higher levels of human gonadotropic hormone. And there's a whole bunch of other hormones that are up and down and all over the place. And that's why we can't copy it exactly. These hormones begin to rise with the onset of pregnancy, but the concentrations in the pregnant person's body may also vary up and down during the pregnancy. Not surprisingly, because hormones do change, not only in pregnancy, but also in the normal state. I guess pregnancy is a normal state. Okay, next slide, please. So inducing lactation should work if we provide all of these hormones. Each hormone has a role to play in the preparation of the breasts to make milk, with milk production starting about 16 weeks of pregnancy. So many new mothers are told, oh, there's no milk in the first few days, right? I'm sure that some of you probably were told this. Of course, there's milk in the first few days because milk has been started to be produced and accumulating in the breast from 16 weeks gestation. At present, we can't provide all the hormones that are necessary. It's just not possible. Not only can we not provide all the hormones that are necessary, the variations in these hormones cannot be duplicated. And the hormone rhythm of pregnancy is just not practical. So practically speaking, for the moment, we can provide only estrogen, progesterone, and prolactin. How do we make prolactin? By using domperidone. So the estrogen and the progesterone, of course, are easy to obtain and easy to prescribe. Domperidone, we can't prescribe prolactin, but we can prescribe domperidone. It might be best, at least theoretically, injectable prolactin and human gonadotropic hormone are available, but this is awfully expensive. And also you would have to probably get injections almost every day, maybe every two or three times a week. And this is just not practical and it's very expensive. But experience is lacking on how to use them for stimulating the situation of pregnancy. Nobody knows how to do this, at least I don't. Next slide, please. So inducing lactation should work if we provide all of these hormones, but it's impractical to give a person enough progesterone and estrogen to reach levels during pregnancy. So that's another issue. There are risks even to using oral progesterone and especially estrogen at levels to prevent pregnancy. In other words, the birth control pill. It's not completely risk-free, and we have to keep that in mind. Now, we haven't had any serious problems with probably several hundred mothers who induced lactation. So what are the problems that we get with the birth control pill? Blood clotting is possibility. Whoop, whoop, back. No. Okay, blood clotting, increased incidence and severity of migraines for some people. And that is a problem for some of the people taking domperidone as well. If you've got migraine, domperidone sometimes will make it more severe. And an increase in blood pressure. So, you know, there's no such thing as a drug that doesn't cause side effects, and that always has to be kept in mind. Next slide, please. So what are the results? If a person has previously breastfed, this fact does seem, and I put in italics, seem to increase the possibility of that person producing a full milk supply, but probably only a marginally increased possibility. This is our experience. I mean, perhaps we could do things a little bit differently. Maybe if the mother previously breastfed, they would get much better results with another approach, but we've used this approach now for many years, and I think it's the best we can do. Some persons inducing lactation may not produce all the milk the baby needs, but too often this is not due to the process, but rather from lack of support from staff at the birth hospital or legal issues relevant to adoption. Family can drive you crazy because, oh, why would you want to do that? We have such good formula. Yeah, right. From health professionals, formula is just fine from the health professionals. You hear that all the time, right? In certain situations, for example, a partner of a pregnant woman inducing lactation, it may not be necessary to produce all the milk the baby requires, as the partner is supplementing the milk provided for the baby, preferably at the breast. Next slide, please. What if I cannot produce all the milk the baby requires? Well, it would be nice if inducing lactation always produced a full supply. However, in our experience, it is important to remember that breastfeeding is much more than breast milk. Something we forget, and something that we, when we hear from women in the United States, they're always saying, "Oh, I'm not producing enough milk." And yeah, perhaps you're not producing enough milk, but you can still breastfeed. And so stop the bottles. There's a better way of supplementing if you really need to, because breastfeeding is a relationship. It's a close, intimate, physical, and emotional relationship between two people, at sometimes more than two people if there's twins or triplets. I would hazard to say that the single most important reason that a person desires to breastfeed is the relationship. They don't always know this when they're inducing lactation, but they find out. Furthermore, breastfeeding helps to develop that close emotional relationship. So breastfeeding is a close emotional relationship. It's there and it's important. Next slide, please. So if you cannot produce all the milk the baby needs, you can, and we recommend you do, supplement the baby at the breast with a lactation aid. Now, I'm not a big fan of the Medela SNS. I think it's very difficult to use. We use something else. Now, anything you see in yellow and underlined is a link from our clinic. So, well, not necessarily from our clinic. There are also articles and stuff like that. But if it's a link, so this link shows you the lactation aid being used from our clinic, and I think it works much more frequently than the SNS, which is a real nuisance, I find. And it's not always easy to use, but it can be used. Just practice. So supplements may include donated breast milk or formula, but it's important, and we say this often: do not pay for donated milk. Get to know the person, the breastfeed milk donor personally, and get the milk in person. In other words, they bring it to you, or you go to them. Because we cannot, even if the person is reliable, they put they send it by mail. Well, what's going to happen to that milk? Even with delivery service, they can get lost. So if it melts, it's gone, it's finished. And I think the important thing is somebody who is close to you geographically. In other words, you develop a relationship with that person who's donating. So why do we say this? So that the milk can be delivered in person. There's less chance of topping up the milk donation with formula because it's been done. No problems with mail or delivery companies. Get information on how to go about getting safe donations at this website. So you need to click that website in order to get the place that will arrange and tell you how to arrange donated breast milk. And it's different in different parts of the country. Now, this I don't think will work, but maybe try clicking it, Dubraska, see if it actually works. Looks like no. Okay. Yes, you can have the slides. Okay. Anyway, this is a video clip showing a baby who was 5 weeks, was born 5 weeks prematurely. He's now at term, and of course, like happens too often in the intensive care premature nursery, They don't believe that breastfeeding can work if the baby is premature. So he was given lots of bottles. Now he's now latched on, and I'm going to introduce the tube, and the tube will supplement him at the breast so that he gets milk only at the breast. And this actually worked very well for him. Next slide, please. Okay, so let's look at the medication. We start the person inducing lactation on a combination birth control pill, which I've already mentioned, of course, which gives them both estrogen and progesterone, as well as domperidone, which increases the prolactin levels in that mother. It's been said, without proof, that birth control pills with a relatively higher concentration of progesterone may result in better milk production. Now, I don't know. I don't think there's any proof of that, but I guess it won't harm. Yasmin is one birth control pill that has a higher percentage of progesterone than others. And I'm sure that where you live, there are other brand names that fit that picture. Again, I don't worry about it too much. I get what we can get. If the birth control pill has placebos, they should be skipped. You're not preventing pregnancy, you're making milk. And so skip the placebos and go straight to the first pill in the next package. It's expected for a person not to have periods during this time. So all this time, let's say the baby is due in 8 months. The person inducing lactation should not have a period during that time. And if they do, don't stop the medication, but go to see your doctor just to make sure everything is okay. Next slide, please. So during the pregnancy, milk starts to be produced at about 16 weeks gestation. For this reason, we suggest the person inducing lactation be on the birth control pill at least 16 weeks and continue it until about 6 to 8 weeks before the baby is born, and then stop the combination pill. So in other words, the person inducing lactation will be on the combination birth control pill plus the domperidone for at least 22 to 24 weeks. Now, we sort of just made that up because we say you start producing milk around 16 weeks of pregnancy. Okay, then let's start as if you were, let's get you on this medication so that you're on the protocol for at least 22 to 24 weeks, because we want you to stop the birth control pill about 6 to 8 weeks before the baby is due to be born. Next slide, please. So here's domperidone. Domperidone is, I can say right away, is not illegal in the United States. In fact, veterinarians use it all the time to increase milk supply. And so not for themselves, but for the animals. So, you know, $1 million racehorse is worth a lot more than mothers. And so they will treat those racehorses if those racehorses are not producing enough milk. So domperidone increases the prolactin levels and thus stimulates the production of milk, though not while the person is taking, yes, good, lean up. So though not while the person is taking the combination birth control pill, because the birth control pill will prevent the production of milk. Domperidone should be taken simultaneously with the birth control pill and continued after the baby to be breastfed is born. Okay, so you'll need to stop the birth control pill because that will prevent milk production, but the domperidone will probably need to be continued and continued after the baby is born to maintain the milk production for as long as needed. This may mean 2 years, 3 years, but listen, domperidone, when people were using it, they don't use it anymore because better medications for reflux are now available, but domperidone used to be used for reflux. So people that were on domperidone, some of them were taking it for years, even decades, and it's a pretty safe drug. Okay, next slide, please. We start with a dose of 3 tablets 3 times a day at the same time as the mother starts the birth control pill. After the baby is born, we sometimes go up from in 2 steps, 40 milligrams 3 times a day, and then 15 tablets a day, so 555. The main reason not to go to the higher dose right away is to prevent the side effects which may occur at 9 pills, which may not occur at 9 pills, but may occur at 15 pills. And if 30 milligrams 3 times a day works well, why go higher? Next slide, please. Okay, if for some reason the person inducing lactation wants or needs to stop the domperidone, it should not be stopped quickly. We usually recommend that if you're taking 9 pills a day and you want to stop the domperidone for some reason, then you drop a pill a day and you do that for a week, and then you drop a pill a day. So in other words, it'll take you 9 weeks to stop the domperidone. Because on occasion, if you stop it too quickly, some mothers or some people will get anxiety, sleeplessness, depression, but this is uncommon. But we just want to prevent it. A small number of people taking domperidone for many weeks will have symptoms of anxiety, depression, difficulty sleeping, and other symptoms if domperidone is stopped too rapidly. And I again emphasize this is uncommon, but it's very distressing if it occurs. We generally recommend dropping a pill a day, a week, always on the same day, because if you don't do it on the same day, you may forget. So if the person is taking 12 pills a day now, they will take 11 pills a day for a week, then 1 week later, 10 pills, etc., etc. Thus, it will take, in this case, 12 weeks to wean off completely. Next slide, please. The side effects of domperidone may include weight gain. Now, this actually disturbs many more mothers than I thought, or people inducing lactation. But it actually is liquid. It's not real weight gain. So that this reassures a lot of people, but not everybody. And of course, some mothers who are taking domperidone will, because they are breastfeeding, eat more. So often it's not the domperidone, it's eating more. Other side effects of domperidone include headache, which is usually mild in the and transient, lasting no more than a few days, abdominal cramps, also which are transient and mild, and dry mouth, which tends to be more persistent. Worsening of migraine headaches may occur. And I think it's very important that somebody who has migraines, even before they start the domperidone, that they speak to their doctor about some sort of medication to prevent migraines. Preventing migraines is more important than treating them, even because if you have migraine headaches, you know what I mean. Who needs it, right? Monoclonal antibodies are now being used frequently to prevent migraine headaches, and they are very, very good, but they are also expensive. Weight gain is thought to be, I have mentioned that already. Some women will have menstrual irregularities on domperidone, but if they are simultaneously taking the birth control pill, this should not happen. However, when they stop the birth control pill in anticipation of breastfeeding, a woman will have heavy bleeding, usually because they haven't had bleeding for many months, often fairly heavy, as I said. This should not last more than a few days. If the person has bleeding while taking the pill and domperidone, she or he should be, there was supposed to be a slash there, he should be seen by, well, no, not a he. Anyhow, should be seen by her doctor to rule out the cause. Because as long as you're on the birth control pill, you shouldn't be having bleeding. Next step. Okay, the notion that domperidone is dangerous if you have any sort of heart problem is nonsense, pure 100% nonsense. Domperidone is not dangerous for the person inducing lactation if they had a heart murmur as a child. I get this question unbelievably commonly. If they have a bicuspid mitral valve, if they have supraventricular tachycardia, or if they have any close relatives with such problems. Only if there is a history of a close family member dying suddenly and unexpectedly should an electrocardiogram be done on the person to be taking domperidone before starting it. And even with such a history, if the QTC interval, now I know that many of you don't know what that is, but it's finding on the electrocardiogram. If the QTC interval on electrocardiogram is normal, there is no concern about taking domperidone for a heart problem. Of course, the internet has scary information about domperidone, so doing an electrocardiogram for concern is actually the most common reason we do it. The mothers have read up on domperidone and they say, I don't want to take it because I'm going to die. No, you're not. Anyway, next slide. Okay. It should be noted that many drugs, including SSRI antidepressants, some antibiotics, and many others prolong the QTC interval, but rarely, if ever, is an electrocardiogram done for someone taking these drugs, because the scare is on domperidone, not on sertraline or Zoloft. Our experience with tens of thousands of our patients taking domperidone is that it's a very safe drug. And so compare this to how many people die in the United States every year of C. difficile infection, usually due to antibiotic use, often inappropriate use, by the way. 15,000. 15,000 every year. True, most of them are over 60, so I guess that doesn't matter. Next slide, please. As I can only I can say this among you guys, because I'm over 65. Okay. What if domperidone is not available in my country? This is a problem in several European countries and in the United States. There is also a reluctance on the part of many physicians to prescribe it at all, even in Canada, or only is in ineffective doses and frequently only for limited time. This is due to the negative and incorrect information that domperidone is a very dangerous medication. It may be necessary to get domperidone online, and it's very easy to get it online from New Zealand. Click that link and you have the pharmacies. I think there are 2 of them in New Zealand that will send it, but it takes up to 6 weeks for the medication to arrive. So it's not that big a problem if you're inducing lactation. It is a problem if you want to make milk or more milk. So there are at least 3 links there that will get you domperidone from pharmacies in New Zealand, in I forgot where else. It may, okay, next slide, please. Oh yeah, so here's the New Zealand pharmacy. So there are 2 of them. Oh, Vanuatu as well. Okay, and it takes that time. However, some websites change all the time, so you need to look it up. Okay, next slide, please. So what if I don't have 22 to 24 weeks time before the baby is to be born? Well, if that's the case, is doing it as a helper with breastfeeding. In other words, one of the partners is pregnant and will be breastfeeding, and you want to help, or to supplement for a pregnant partner, then they can continue the process longer than 22 to 24 weeks, indeed until after the baby is born. On the other hand, if this is not the case, then we prefer the person take only the domperidone. Okay, you don't have the time, don't waste the time by being on the birth control pill. The problem is that the birth control pill will inhibit milk production, and people don't believe that. How many patients do we have in our clinic who were doing fine with breastfeeding, were put on the birth control pill, and all of a sudden, I'm not making enough milk? What happened? Yeah, it's the birth control pill. And a lot of doctors don't know that. It doesn't seem to happen to everybody, but it happens to enough. Okay. The problem is that the birth control pill will inhibit milk production, so recommending continuing the birth control pill until the baby is born or longer is a problem that needs to be considered. So is 14 weeks on the birth control pill plus domperidone okay? Yeah, the time is short, and the longer the time, the better. And some people just produce lots. You'll see in this in a slide in a little while. Next, please. Okay, when do I start putting the baby to the breast? Well, as soon as possible after the baby's birth, preferably during the first day, preferably as soon as the baby is born. Now, in the province of Ontario, in Canada, where I live, it's very possible for the person who is adopting or taking the baby or whatever, can be in the delivery room and can take the baby right away and put the baby right away to the breast. Now, this is not true in all places. In the United States, in many states, it seems not to be possible. I don't know how it is in many, many countries. But again, most of the babies we see, or most of the mothers we see that are inducing lactation are in Ontario. So as soon as as possible after the baby's birth, preferably at the first day, preferably as soon as the baby's born. In many jurisdictions, the person inducing lactation can take the baby immediately at birth in the delivery room and put the baby to breast. If this is not possible, the person inducing lactation should let the hospital staff know in advance that they will be the parent of this baby and that they should avoid feeding the baby with a bottle. A newborn can be fed by spoon or open cup without difficulty, or if the birth mother is agreeable, she can breastfeed. And at first I was surprised how often the birth mother would be happy to breastfeed the baby. Now, I know this is not always the case, but it's very frequent. So good. It's better for the birth mother because she doesn't become engorged. She doesn't have to pump her breast. She puts the baby to the breast. Next slide, please. Oh, okay. There are advantages to the birth mother doing so. The baby will get the opportunity to receive breast milk exclusively for the first few days or even longer. This also helps to prevent painful engorgement in the birth mother. Why pump to relieve engorgement if the baby will do it? The birth mother may bond with the baby if she breastfeeds the baby, and this is a good thing, but it doesn't mean she will not give up the baby. In fact, we've never had this happen, that the birth mother changed her mind. Some have pumped for the person inducing lactation for many days and even weeks, and a few, not very many, but a few actually help the mother with breastfeeding by breastfeeding the baby and teaching her about breastfeeding. Now, again, this is not a common thing in our clinic, but okay. Next slide, please. Okay, so getting the newborn to latch on. A baby will latch on to the breast if he goes to the breast and gets milk, so having even a low supply will be enough to get the baby to latch on. If it helps, if the latch is a good one, and there are 2 links there to show you what a good latch is, it is for this reason that bottle feeding and pacifier use should be avoided. If the baby does not latch on, feeding him express milk by cup or even finger feeding may work. I'm not a big fan of finger feeding. I think you need to use finger feeding to prepare a baby who is not latching on to latch on. So you finger feed him for a bit. That's a video that's in yellow underlined, showing me finger feeding a baby to get a 2-month-old baby who's never latched on to latch on. It would be wonderful if the woman who gives birth breastfeeds the baby for at least a few feeds. Next slide, please. So here is a brand new baby being cup fed. As you can see, this is not breast milk, but what can I say? It was actually a baby who was not latching on, and the mother had trouble to express her milk, a newborn baby. So we fed the baby by cup. Next slide, please. Okay, getting the baby to latch on. Now, not done very much in Canada or the United States, but it's been shown over and over and over again. If the baby is born and the baby is put on the mother's abdomen, the baby will crawl up to the breast and latch on. That takes about an hour for it to occur, and it doesn't have to be the baby put to the skin. The baby will crawl up to the breast and latch on all by himself. The breast crawl is best done immediately after birth, but it can still work even weeks after birth. So there are 2 videos. The first one shows the breast crawl. It's called Breast Crawl versus Computers, or Babies versus Computers. And it shows a baby. The video is cut down from over an hour to about 7 or 8 minutes. And it shows a baby just born crawling up to the breast, latching on. The baby is taken by the nurse, and the father says, "Why are you doing this? The baby almost latched on." And she says, "Well, we have to weigh the baby to put the information into the computer." Oh my God. So the baby was interrupted. and the whole process was interrupted, and the baby was, well, actually does latch on, but not well. And then there's a 36-week gestation baby, 2 kilograms, breast crawl, latched on, drinking. And there's an article in Acta Pediatrica from 2011 that goes through the whole process of the breast crawl. Next slide, please. If the baby you are adopting is already 3 months old when she comes to you, she or he comes to you, what do you do then? Well, you have a notion of when the baby will come to you, and it's within a year, say, then start inducing lactation now. If, as usual, the baby has been bottle fed for its entire life, you may have to proceed as if you were doing relactation, which comes in a few minutes. The other thing is that you might be able to do the breast crawl with that baby. This means stopping the birth control pill as soon as you know, but continuing the domperidone, even increasing it up to the maximum dose. It means lots of skin-to-skin contact with the baby as much as possible, and safe co-sleeping. And there's an article there about safe co-sleeping. Next slide, please. Okay, if the baby you are adopting is already 7 months old when she or he comes to you, actually, this is actually in a way better, but maybe easier because you can stop the bottles, right? A 7-month-old doesn't have to drink from bottles. A 7-month-old can drink from a cup easily, but also the baby can be eating food. And so how much food do you give the baby? Well, as much as the baby will take. Isn't that what we usually say? As often as the baby will take the food without forcing. And you can add your milk or other liquids such as olive or vegetable oil to the food. The baby doesn't have to drink any supplements. Do not give commercial infant cereals because they are just rubbish. They're expensive, low in nutrients, bad tasting, and often constipating. And then there's this article on our website about food. Next slide, please. If the baby's actually a toddler you are adopting, say the baby is 18 months old, when she comes to you, this is a completely impossible situation if the baby was never breastfed, right? Wrong. Not true. Again, stop the birth control pill, continue the domperidone. Some of these toddlers are still on bottles, but should not be. There's no reason an 18-month-old should be on a bottle, but nevertheless, most are not. Nevertheless, they may take the breast if they are shown, for example, other toddlers breastfeeding, animals at the zoo breastfeeding or on television, films of breastfeeding toddlers. The following photos are of toddlers who started breastfeeding at ages well above a year, never having ever taken the breast before. They are not adopted, but for reasons not necessary to discuss this here, they were never breastfed nor given breast milk by bottle. So next slide. Okay, so a 2-year-old who latched on for the first time 1 month before this photo was taken. This baby was not breastfed ever before this, a month before this photo, until a month before this photo. Next slide, please. The previous photo, the child was bottle fed with formula until 18 months of age. By the way, formula to the age of 18 months is completely unnecessary and is formula company marketing only. Then just solids until 2 years of age. I presume she was drinking something. From 2 years of age, breastfed and solids. And this photo is her breastfeeding about a month after she first took the breast. Still, breastfeeding at the last visit at 2 years and 5 months. Next slide, please. Here's a photo I received. This is me saying this. Here is a photo I received from a friend who supports mothers breastfeeding. It shows a 3.5-year-old breastfeeding for the first time in her life. This girl was bottle-fed formula since birth. Then 9 months ago, her brother was born. I helped the mother with the breastfeeding of the baby, and now his big sister joined him, and they have been tandem breastfeeding for about a month now. So next slide, there it is. Okay, so it is possible. And again, it's often showing the example of the baby breastfeeding. Next slide, please. Transgender male, breasts removed but still has female genitalia, gave birth to a baby boy, has written a book about his experience and spoken widely about inducing lactation. Still breastfeeding with donated breast milk at 15 months when this photo was taken. Not our patient, but he came to visit us. He lives in Winnipeg, Manitoba. And as I say, we took the photo there. So I have to say that we've never had somebody with a beard and a mustache actually breastfeeding. We have had transgender males, but they didn't have a beard. And okay, next slide. Our approach, oh, sorry, go ahead. Okay. A parent-to-be wanting to induce lactation contacts our clinic. We ask him or her, though her 99% of the time, well, even 99.9% of the time, to come in person to the clinic. And we do a general history, hormonal problems, breast reduction surgery, et cetera, previous breastfeeding experience, if any. We do a relevant physical examination, breast for lumps, scars, significant asymmetry, etc. We then discuss the procedure and ask about previous experience with hormone medication and domperidone, any cardiac issues, etc. Next slide. After this initial history and physical examination, we ask another mother at the clinic who is breastfeeding her baby if she would mind if this mother can be observing her. We would like the mother to note if the baby's latch is good or not, presumably good if we've been helping this mother, to note when the baby is actually drinking milk at the breast and when the baby is not drinking. This is something that even many lactation consultants and especially pediatricians or doctors who say they are breastfeeding experts don't know. They don't know how to look at a baby and say this baby is drinking milk or this baby is not drinking milk or this baby seems to be drinking milk but not that much. Okay, we would like the mother to note if the baby's latch is good or to note if the baby's drinking. Okay, the use of breast compression to help the baby get more milk, when to change sides, the use of the lactation aid at the breast if it is being used. Next slide, please. Okay, we continue after the observation back at the private room to ask if the mother has any questions or concerns. We ask the mother to keep in touch by email. We follow up about 6 to 8 weeks before the baby is to be born, just to make sure there are no further questions or concerns. Many mothers do not pump a lot of milk before the baby is born, and this is to be expected. Things may change when the baby goes to the breast, just like it does if the pregnancy was a usual pregnancy. Next slide, please. So, the adopting mother breastfed a biological child for 18 months, 4 years before. Since then, several miscarriages, cause unknown. She decides to adopt. 1 week before the baby is due to be born, she finds out she can adopt him. Next slide, please. So first contact with our clinic by telephone. I prescribed domperidone. I no longer, by the way, answer phone calls, only emails. Okay, I prescribed domperidone. She also starts mother's milk tea. She brings the baby to the clinic when the baby is 2 weeks old. He is exclusively breastfeeding. Next slide, please. According to our scale, he is about 250 grams below birth weight. So that's half a pound below birth weight. But when he's on the breast, he's breastfeeding beautifully, getting lots of milk. And knowing how to know a baby is drinking is the key to understanding. And a lot of people who pretend to be lactation consultants don't know this. It looks really good, but I must admit I'm worried. The following week, still exclusively breastfeeding, the baby gained 200 grams. Be careful about trusting weights taken on different scales. Be careful about trusting weights taken on different scales. Even on the same scales, errors are sometimes made. So for example, not that long ago, we weighed a baby in our clinic. We only have one scale, so it wasn't the scale that was the problem. And the baby gained a kilo or 2.2 pounds in 1 single week. Now we know that's not likely, but people, including pediatricians, they believe the scale like it was the word of God. but it's not. If you look at the top photo here, this baby on this scale weighs 3 point, I can't read it, it's too small. You can see it, right? Or not?
3.510, doctor.
3.5 kilos?
Yes.
Okay, and on the bottom scale, same baby,
3.1.
that was only 1 minute later. We moved the baby from the scale on top to the scale on the bottom, and the baby lost 400 grams in 1 minute. You cannot trust the scale. So how do you know if a baby is drinking well at the breast? Next slide, please. Now, this is actually a video. So if you guys get the, oh, that's me 2 weeks ago. Anyway, if you guys get the PowerPoint, this video shows really good drinking in a baby who was not latching on. We got the baby to latch on. Yeah, no, you can't open this video. So, but when you get the PowerPoint, you should be able to open the video. You should be able to see the baby drinking really well. And how do you know? Watch for the pause in the chin. Here, okay, let me see. Okay, if the baby drinks like this, pause, 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 the baby is getting lots of milk. And the longer the pause, the more milk the baby got. That's what really counts, not the scale. Next slide, please. Okay, and after that, the baby is breastfed exclusively for 6 months, gains well. He is started on food at 6 months and breastfeed 18 months altogether. I think the mother said that, well, she didn't say, but she fed her first baby 18 months. So she didn't want to favor this baby. I don't know. Anyway, mother took domperidone for 15 months. And the following photos show the baby at 3 months of age and again at 6 months. So, okay. So the baby that I'm talking about is on the left. Okay. So that's the baby at 3 months. This is the mother on the right, also induced lactation. And I can't remember why I put the photo there. But anyway, that's another one. And next slide, the baby is 6 months old, just started solids. Okay, next slide, please. Okay, so relactation. Would this be a good place to answer some questions, or should I go to the end?
Let me check. We could do stop here since we're gonna change the subject and see what we have pending. First, a lot of greetings.
Hello.
From everywhere. Ukraine, Curaçao, USA, Barcelona, so Indonesia, a lot of people from Indonesia too, Mexico, Kosovo.
Egypt. Somebody said Egypt.
Yeah, yeah. So let me see if I get. Yes, they're asking about the slides.
Yes,
Okay.
yes, you can have the slides. You can have the slides.
Dr. Newman prescribes in Ukraine. Why not? I think they're asking about the domperidone. I have some questions myself, so we can also go into it, but I want to check if any of them have maybe the same question. More greetings. Egypt, Libya. No, I don't see any questions. If any of you have a question at this moment, could you please raise your hands? It's an icon that you have on your Zoom, or we have one here said, when to start pumping after starting domperidone?
Okay, well, we're talking about induced lactation. So the mother or the person that's taking domperidone is also taking the birth control pill 99% of the time. So there's no point in pumping during that time. I don't think it does any good. 6 to 8 weeks before the baby is to be born, that's when we recommend stopping the birth control pill, start pumping now. Now, there are issues about, pumping. I mean, if you have a job where, there's no private places in order to pump, then you may not be able to pump while you're working. But you can make up in the evenings and in the weekends or other times when you're not working to catch up on the pumping. So yes, don't start. There's no point in pumping when you're taking the birth control pill.
Okay, here's another question says, I don't have clear when a mother with co-lactation has to stop BCP and start pumping, breastfeeding. What is the meaning of BCP?
Birth control pill.
I'm sorry, I'm not American, so I don't know those. English not my first language, so this is a question. I don't have clear when a mother with co-lactation have to stop BCP and start pumping.
Well, it's not 100% clear either. What I wrote is that there's no rush for the person who is inducing lactation to start pumping stop the birth control pill and start pumping 6 to 8 weeks before the baby's to be born, because presumably her partner who is pregnant will be breastfeeding. So, it's not that clear. I think that it's important that the mother who is pregnant, should get her breastfeeding established to begin with, and only then should her partner who is inducing lactation then start to become involved. Okay.
She's also asking how much pumping.
How much what?
Pumping.
Well, pumping is a question of convenience, no? I mean, I mentioned the situation where that person inducing lactation is working, say in an office or even in the hospital. It's not always easy to pump. So you have to make it up outside work in some cases. On the other hand, we have lots of mothers who are working at home who are breastfeeding while they're sitting at the computer and working at home. So, it's a question of convenience. It's a question of possible. And many mothers, many people inducing lactation, as I mentioned, they're working in a place where it's not convenient to pump. There are no private rooms. I don't think they should be pumping in the bathroom. I mean, if they want to, I suppose, but it's a bit awkward. So they may do, instead of say 8 pumpings in the day, throughout the day, they might do, 2 or 3 in the morning and 4 or 5 in the evening, or do more on the weekend.
Okay, we have a question here. I don't know the name because it only says S, but I will ask to unmute. You can proceed to do your question. Is the person with the S picture?
Yes, yes, that's me.
Okay, sorry, I didn't get the question.
Sandra, go ahead.
Sandra, so me? Yeah.
Yes, go ahead.
I wanted to know if you, thanks a lot for the amazing lecture first. I wanted to ask if it's possible to give a contraceptive pill if the mother has a hormonal loop. Is it safe to add a contraceptive pill to a hormonal loop?
To what? To an IUD? Is that what you meant?
Yes. Yes.
An IUD usually contains only
Progesterone.
Progesterone, right?
Yeah.
I don't know. It's never come up.
Okay.
I mean, if you're taking the birth control pill, then you don't really need the IUD. If you want to keep it because you paid a bundle of money for it, but you're going to have it taken out, if you're inducing lactation, you're going to have it taken out anyway, because it will inhibit lactation.
Okay. Okay. Thanks a lot.
Okay, we have someone else. I don't see your names because many of you haven't renamed yourself, but I'm going to ask you to unmute. You tried to speak a minute ago. Yes, go ahead.
Yes, I am asking, I have cases of if a baby 4 months old and we are inducing lactation, it's hard for the mom to give the cup. She is refusing. So I ask her to put the powder of the formula on the food. how much formula or how many scoops can we add to the food, and it's not a nutritional problem. Yeah. Can I add 3 scoops on potato or something of formula
Yeah.
to stop?
Yes, of course. Why not?
No maximum amount for formula. It can't cause a nutritional problem.
No, I don't think so. But I mean, don't forget, we're trying to induce lactation here. And so if the baby will eat enough, then really the baby doesn't necessarily need milk.
Yes, sure. I know that, but at the first days he's taking so many food. Yani it's a little amount, so I add formula for nutrition.
Yes, but sometimes babies will eat a lot more than this much. So if they eat lots of a wide variety of foods, then you may not need the formula. But okay, sure, add what makes them happy.
Thank you so much.
Okay, and the next, I don't know where we are in the slides. Oh, I think we're okay.
Yes, I have, let me see. What do you do if the mother have, I think it's this one from Sandra, we already answered. The same one. How can we induce a mother with a baby under 6 months old that already involved no milk supply? Because I tried several patients just with Dumpergon, but it's really hard to get supply to come back. Can we add up BCP to gain new lactocytes?
Well, the problem with that is that, you're not going to produce milk as long as you're taking the birth control pill. So I think that let's get the baby off the formula. Let's get the baby, a 6-month-old, just eating food. Yes, you can add, you can even add olive oil or some sort of high calorie liquid like that, or vegetable oil to the food so that he gets more calories. And you don't if the diet is varied, that contains all sorts of things, not just baby cereal, you don't really need formula or even milk. Babies can grow without, at 6 months and older, can grow without receiving milk products.
I have to say that myself, my mom will not breastfeed long. She will even give me to the neighbor so she could breastfeed me for a while. And I will vomit the formula. So since I was really, really young baby, she didn't know what to do because she didn't know best. So she will blend the food, put it in the bottle and give it to me, and up to be one of the most healthy in the house.
Okay, but this is not recommend. The bottle is still not recommended.
It's not recommended. No, it's not recommended. But I'm saying because she didn't have enough knowledge, she was really young and didn't know what to do because I was vomiting the formula. She ended up feeding me with food, like you're saying that because right now it's happening that we may say, and they're starting to understand that after 12 months they can just get rid of the formula, or even if they're so stressed about giving milk, just give normal milk. But the main question right now is like, what do I do? I don't get the formula. I don't have the time to induce because I haven't breastfeed since the baby was born. Let's say the baby is 8 months. So now that your advice will be, okay, let's focus then on the food, give variety of food that have all the nutrients that the baby will need to.
That's right. A wide variety of food. A wide variety of food in adequate amounts. There's nothing magical about milk, like cow's milk or formula. If they'll eat enough, it's good enough. Again, with the emphasis on a wide variety of foods in adequate amounts. Okay, let's carry on, and we'll come back to the questions later. Okay. Keep your questions now, and we'll go to relactation. Okay. So too many mothers have stopped breastfeeding because they have been given poor advice. Okay. Mothers often stop breastfeeding because in the first few days, the baby needs formula, is given formula, and that's underlined. They don't really need it. because of the concern of hypoglycemia or jaundice. Those are articles about hypoglycemia and jaundice from our website, or the baby does not latch on, or because people believe that there's no milk in the first few days, or such and such drug, which is hardly ever necessary to stop breastfeeding for medications, because the mothers have sore nipples. Now, sore nipples are caused by a poor latch, and sore nipples can be prevented. But too often, the only answer for sore nipples is a nipple shield, which cuts down the milk supply, or giving the baby a bottle, or taking the baby off the breast to rest the nipples. But the answer is fix the breastfeeding. Okay, next slide, please. Okay, or the mother is told that the baby's not gaining well. How do they know after 1 or 2 or 3 days that the baby's not gaining well, when I showed you how the scales can cause problems? Or she might as well just stop since formula is so good. That's what we hear all the time. Oh, formula is just as good, especially when we hear from when the mothers say it was the pediatrician that says that. It's almost as if pediatricians have been taught in their training that formula is just fine and don't worry about breast milk. And because they never learned anything about breastfeeding. The baby has breast milk jaundice. Breast milk jaundice is not bad for the baby. Breast milk jaundice, oh, we're not recording apparently. Oh, I don't hear you, Dubaraska.
I haven't stopped the recording at all, so
Okay.
it should be recording.
Okay.
In order for me to see, I would have to stop sharing. Do you want me to check for a second?
No, I'm okay. Somebody said
Okay.
we are still recording. Okay, I see that it is recording. Okay.
Mm.
All right. So breast milk jaundice is not only normal, is not only not a reason to stop breastfeeding, it's actually good for the baby. And that that link will give you the answer to why breast milk jaundice is good for you, not bad. Or the mother has an infection and the baby may get it. Well, if the mother has an infection, the baby already got it. And the best protection for the baby, breastfeeding. The mother has another illness and needs to rest. We see this with things like rheumatoid arthritis. That's not a reason to stop breastfeeding. And the host of other reasons that may vary from the ridiculous to the absurd. Next slide, please. So relactation, what to do? If the baby will latch on, everything is possible. Follow the approach to the baby who's not getting enough from the breast. And again, remember these yellow, this yellow printing underline is a link that tells you how to do that. If the baby does not take the breast, a nipple shield is not the answer. An important step is to stop using bottles and pacifiers or the nipple shield. An open cup or a small spoon can be used to feed the baby. If the baby is 3 or 4 months of age, food mixed with breast milk, preferably, can be substituted for the bottle. And I showed you the video, or I didn't show you the video, but this video shows a 4-month-old. The mother was using a lactation aid to supplement, and she was getting tired of it. And I know sometimes it's not easy to use. So this is the first taste for this baby of any food. And I think it's banana. It could be avocado that we're just feeding the baby. And she's very surprised by the food. And then she really wanted more. You can see that when you open the video. Next slide, please. So which food at 3 months? Well, as we suggest, we avocado or banana just to get the baby used to it. And once they're eating well, within a few days to a week, you can give them even little pieces. Not infant cereals, which are low in calories and other nutrients except iron, and most of the iron ends up in the baby's diaper anyway. Olive oil or other vegetable oil to add calories, as much as the baby will eat, as often as the baby will eat the food without forcing. Don't force babies to eat. There are some cultures where babies, are forced to eat. No need to panic. It wasn't that long ago, okay, a generation ago, that mothers were told to start food at as early as 2 weeks after birth. I have a book that was printed in Canada. It's called The History of Breastfeeding in Canada. And there were declarations from pediatricians that said, I start all the babies in my practice with food at 2 weeks of age. And it worked. Not a good idea, but it works. Next slide, please. What else? Lots of skin-to-skin contact. Increase the flow of milk with domperidone. Babies find the breast and latch on often because of the sensory input from the bare breast. And there's an article that talks about it. It's kind of a boring article, but it tells you what the Montgomery glands do. They attract the baby to the breast. If the mother can manage to feed breast milk by cup or spoon, increase the flow of milk with domperidone. Babies find the breast and latch on often because of the sensory input from the bare breast. And there's an article that talks about it. It's kind of a boring article, but it tells you what the Montgomery glands do. They attract the baby to the breast. If the mother can manage to feed breast milk by cup or spoon when skin to skin with the baby and the baby near the breast, this may help the baby to latch on. Taking a bath with the baby, skin to skin, sometimes helps too. Next slide, please. It is important your family doctor know you are taking the medications that we prescribe in case of side effects arise. Now, we always send a letter to the doctor, but we know how doctors read letters. And it is important she or he know you are inducing lactation in case side effects of any sort appear and may be related to inducing lactation. Next slide, please. What is a good latch? Finally, it's important the person inducing lactation achieve a good latch just as any breastfeeding. A good latch prevents sore nipples and allows the baby to receive the most milk possible from the breast. And there are 2 links there that show the asymmetric latch, and there's a latch quiz as well. Next slide, please. This is a video and it shows a good latch. Okay, ask the question. You don't need avocado at 3 months. It's just a way of feeding the baby instead of giving the baby bottles of formula and getting the baby to start. We'll ask the question later. Okay, this is also it's 2 slides put together, but if you click it, it actually moves, which surprised me, and it shows the good way of latching the baby on. Next slide, please. And this is a video that shows really good drinking. The pause in the chin, the pause in the chin. Okay, that pause in the chin says I got a mouthful of milk. The longer the pause, the more milk the baby got. Next slide, please. This baby, on the other hand, is 12 days old and is not drinking at all. Instead of pauses in the chin, the baby is doing only nibble, 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 nibble. Next slide, please. This also is a video, and it shows a baby who is in between. I call it borderline drinking. In other words, the baby is drinking, but should be drinking more. And we taught the mother a good latch, which you see there, how to know the baby drinks at the breast, how to use breast compressions to increase the milk supply. Next slide, please. Okay, so steps to increasing milk intake by the baby. Get the best latch possible. And there are links there, 3 of them. Know how to know the baby's getting milk from the breast or not. And there are links there that show good drinking, bad drinking, in between. Use breast compressions to increase the milk intake of the baby. There's the link. Okay, next slide, please. When the baby is not drinking on the second side, so offer the second side when the baby's not drinking on the first side. When the baby is not drinking on the second side, you may have to supplement, but maybe not. There's a lactation aid at the breast if you need to supplement. Domperidone can increase the milk flow to the baby. Read carefully. Domperidone. We start with a dose of 3 tablets 3 times a day and often go up from there. The bottle is a problem. Even if you must supplement, it is better to supplement with a lactation aid at the breast. Next slide, please. So here's contact information for me. Breastfeeding questions, don't ask the mother to email me directly. Ask her to use that second link, which says ask a breastfeeding question. Our website, www.ibconline.ca, allows free access and contains information sheets in English, some in French, a few in Russian, Portuguese, all of them in Indonesian, but only the English ones are up to date. The others are very old and probably need to be revised, but I just don't have time to do it. We also have videos with explanatory text in English, French, Spanish, Chinese, etc., etc., etc. The information is pretty good and up to date. And then we have information about our teaching institute for those who want to come to learn with us, amongst other programs, a diploma course in lactation medicine. There are blogs in English, French, and Portuguese. All our blogs are available in English, French, and Portuguese. We have a few in Chinese, but I can't tell you if they're any good or not. And in Vietnamese, also can't tell you if they're any good in Vietnamese, but they were translated by a official translator. Next, so I can't remember. Okay, that's it. And this is our breastfeeding book. And this is a child reading one of my older books. And I think that's the end of the slides. And then is there another one? Okay. All right.
Thank you so much, Doctor. We really appreciate it. Let's go to the chat to see the questions are here pending.
Is that from Nina? What did I miss?
What are success rates for inducing lactation regarding to your experience? How many women reach a full supply if she follow all rules?
Well, the first thing I would say is that producing a full supply is not what we consider success. Because even if the mother has to supplement, then she can include with a lactation aid and she is breastfeeding. And that's the important issue, because breastfeeding is much more than breast milk. And so breastfeeding is really what we're trying to help the mothers with. But if we say how many produce a full supply, I would say somewhere between 15 and 20%. I'm guessing, but I am guessing. Okay. So I don't know, because we haven't always followed them up. And I know that some obviously do produce a full supply, but if we've been, it just seems to be very, very hit and miss. We don't know how closely they follow our recommendations. That's the other thing. And sometimes we don't see them. We want to see them when the baby is born, but they don't always come back. And we assume that those mothers were not able to produce all the milk they wanted, but it may not be true. They may just feel everything is going great. I don't need to go back.
Okay, another question is, let's imagine a mother who wants to relactate a 2-month-old baby. Would you give her domperidone? I guess so. Do you make a difference whether she breastfeed the first day or not?
I'm not sure about that second part of the question, but yes, of course, if the baby is 2 months old, yes, of course, we'll try to boost the mother's milk supply, and we try to see her at the clinic. At 2 months, it's not necessarily impossible to get that baby to latch on.
Someone else is saying, we have your book in Ukrainian, in Ukrainian with your sign. Ukrainian unfortunately is not safe.
That's a different book. Okay, but yes, okay. So whoever asked, Dobriden, and the book that's in Ukrainian is I can't remember. Oh yes, it is. It's the ebook.
Okay, someone asking, is pumping involved in relactation at all?
Yes, if the baby won't take the breast, we want to increase the milk supply, and the best way to get the milk supply to increase is the best way to increase the milk supply is domperidone, but also pumping. If you don't take the milk out of the breast, then you won't get an increase. Just taking domperidone may increase it a little bit, but how do you know? You need to increase the milk supply, and that means domperidone and pumping.
How about relactation in mothers with extremely oversupply? The baby had total nursing strike because bottle teeth and look frustration and cannot tolerate with the head let down reflex.
Well, I have to disagree. I don't think there is such a thing as oversupply. If the baby has difficulty with the flow of milk, that's because the baby is not latching on well. And I know, maybe some of you have had babies. If you work in the neonatal intensive care unit, there are mothers there that are pumping, and they're pumping, 2 liters a day, and that means they have oversupply. No, they don't. It just means they're pumping, and pumping does not tailor the milk supply to the baby. So what a mother pumps is not what the baby gets from the breast. So if a baby can't handle the flow, it's because the baby is not latched on well. And I will stick to that. I believe that deeply. And I think we should stop talking about oversupply.
She continues with another question, like if she should give any herbs or medication like peppermint to decrease supply.
No, because there's no such thing as oversupply. The problem is the baby's not latching on well. And we don't know if peppermint works anyway. And we don't even know if blessed thistle and fenugreek actually work, or moringa. These herbs are of doubtful value. And I think the only thing they do is delay the use of domperidone for these mothers that are having trouble.
Another question says, when they begin withdrawal of domperidone after the mother has established her milk supply, or would she continue using it through the entire breastfeeding period? You said that
The
it should be
domperidone.
through- Yes, she
Usually
said that
the
it should be.
entire, yes, during the entire, if they stop it, the milk supply decreases.
Okay, someone else is, can you elaborate more on the solids at 3 months? Is that just to avoid the use of formula?
No, it's it's to avoid the use of bottles. I mean, we don't say you must never use formula. We need to feed the baby, but use of solids, you use less formula. And I think that, again, it depends on the variety of solids that the baby's taking. If the baby's only eating avocado, or the baby's only eating blueberries, then he needs to get more variety of food. If that means formula, well, okay, but feed it the way it's necessary. I'm not against formula 100%. Sometimes it's necessary.
Doctor, there is someone else asking for the same. I think they're all a little bit impact about you saying that they could feed a baby before 6 months, because that's what the World Health Organization advised. But right now we're talking in a different situation. A health baby that is breastfeeding, of course, you should start at 6 months. But we're talking
more
right
or
now
less,
when
right?
there is exactly more or less. But right now we're talking when we don't have milk, formula shortage. That is a strange situation. What we have to do, right? Like we have to feed the baby.
Yes, the baby. That's right. You have to feed the baby. So if a baby is eating a wide variety of foods in large amounts, say at 3.5 months, well, they may not need formula. What's wrong with that? Sure, there are lots of, if he's eating avocado, if he's eating meat. I mentioned that the doctors in Canada were telling mothers, your baby's 2 weeks old, you can eat him, you can give him meat. And those babies ate it. So don't measure. Let him eat. If he eats and he eats and he eats and he's not hungry, that's fine. That's enough.
All right. What minimum time of pausing breastfeeding that is required to start domperidone?
Sorry, say that again.
I really also don't understand. It says, what minimum time of pausing breastfeeding that is required?
No. You can't say anything. If the baby drinks like this, pause, or variations of it, and comes off the breast happy, it's good enough. But be careful. Some babies will then the older babies will stick their fingers in their mouth, and that usually means they still want more. There's no way of knowing because every mother's milk is somewhat different. So a baby who has pause, pause, pause like that, but her milk has got a lot of fat, then that may be enough. You can't just say numbers. You like the numbers, forget the numbers. The numbers are a handicap to breastfeeding. It's like saying 10 minutes on each side, right?
Yeah. There's someone asking about the doses of domperidone that you are explaining is in your presentation, so don't worry. The presentation is being recorded, so you will have the chance to see it again. And it's also asking for how long should be taken, and the doctor explained as long as you're breastfeeding to maintain the milk supply.
Right. And the other thing is if the baby is drinking well at the breast, and the baby's also eating food. So if, in the usual situation, the baby's say 7 months old and is eating lots of food and is happy at the breast and drinking at the breast, you might consider going down on the domperidone, but do it slowly.
One pill
You
per
can
week.
always turn around and start it again.
Okay, what is a good amount of olive oil to give?
I don't know. And you're adding calories to the food if you're adding olive oil. Olive oil, it doesn't have to be olive oil, it can be vegetable oil. It's just that oil contains 9 calories per gram. That's a lot. Whereas protein is only 4 calories per gram.
She meant, I knew that her question with the passing, she was referring to the domperidone. So that's already been clear. 1 second. People keep on writing. I have seen some women taking about sweet spots with domperidone doses, and that going over their own sweet spot can result in lower supply. Can you talk about this?
Never heard of it. I don't agree with it.
Let's see.
You
Well,
know
I
how?
think we're
Oh,
on.
yes. Let me tell you how we see this.
Okay.
They say this by, we see this in mothers who are pumping their milk as well as feeding the baby at the breast. And so they say, well, I took 3 tablets 3 times a day, but you told me to increase it to 4 tablets 3 times a day, and now I'm pumping less. Well, pumping has nothing to do with what the baby is getting. And I don't think a lot of people understand that. In fact, it may be you're pumping less because the baby is drinking more.
Yeah, it's such frustrating sometimes to see the advice of some pediatricians like pump just to see how much milk you make, and it's so nonsense. I have a question. I have a question myself, doctor, over the wet nurses, because some mothers in the mother app in this community were offering herself to breastfeed babies, but they didn't want to go through pumping because we have to say that's really quite a job. And they were offering to just breastfeed the baby directly if anyone was needing it too. And how everybody, mostly of the people react. Some mothers will say, oh, thank you, that's so nice of you. But a grand majority of the people will say, be careful, this is not good. What you're doing, you can get infected, you can get this, you can get that. So I read a lot about it. I did it myself one day with my second baby from my community group of moms that we help. And we have done it before. As you say, we have to be really careful. You have to know the person, be in intimate. So I was helping this mother through her journey. So we were really quite in contact, and I took that decision. But how can you elaborate on these people that is so against to wet nursing?
Well, I don't see why. I mean, I think that if the person that is not the mother wants to breastfeed the baby, I think we should find out, do you have any possible infections, and they should be willing to have the tests done to make sure that they are HIV negative and blah, blah. There are a number of things that you can test for. And if that's okay with the mother and the rest of the family, and this mother wants to help out, that's okay. I don't see what the problem is. I mean, this used to be common.
Yes, it used to become a lot. In fact, there were like gods in the past, when they were doing this job. I don't see any further questions. Let me see.
Okay, so
This
somebody's
slide, yeah.
asking about sharing the slides. That's fine. If you share the PowerPoint, the slides, the videos will when you click the videos, they will show.
Just be aware that the presentation is copyright, so be aware of that. If there's not any other question pending, once more, Dr. Newman, thank you so much for your time and for your passion of educating and delivering information. Everybody's thanking you at this moment. The presentation will be available, and this presentation will also, it's been recorded, so we will post it again. Thank you so much, Dr. Jeff Newman. Thank you to everybody, and I hope you enjoyed this presentation.
Okay, thank you very much, all. Bye-bye. Maybe we'll start doing in-person conferences soon. Let us hope.
Yeah, yes,
Okay.
we're working on it. Bye-bye to everyone.
Bye-bye. Thanks. Bye-bye.